the Board of Supervisors meeting to order. Everyone would join me in the Pledge of Allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
But it's so much better
Oh, it
trying to
feels
do
good
that
to do
on
that,
Zoom.
doesn't it?
Yes, no question.
At least we can get in unison now.
That's exactly right. So, all right, as far as our agenda goes, we do have, under new business, item 5D to add, and that's donation of a canine from the sheriff's office. Are there any other additions or deletions anyone has? If not, I would entertain a motion.
So moved. Second.
All in favor?
Aye.
Passes unanimously. All right, special presentations and appearances. A presentation of a certificate of appreciation for Janice Dillo. And, since this is a husband and wife team, why don't we do, Mr. Walter Dillo at the same time? Mr. Johnson, would you like to join me?
Certainly.
Okay.
Put on my jacket.
I'll stand there and look pretty. You do the talking. How's that?
Absolutely. One of us has got to do it.
Want to read Mrs. Dillo's first?
Would you like me to go ahead and do that now?
At your convenience, sir.
This is a certificate of appreciation from the County of Orange to Janice Dillo in recognition of your valuable contributions and years of dedicated service.
You have to come up so they can get a picture of you.
All righty.
And also, your service award that you have not received yet.
Okay, so you do for the price of one there.
Thank you.
And then this is a certificate of appreciation to Mr. Walter Dillo in recognition of your valuable contributions and years of dedicated service. And I'm sure that our citizens will miss both of you. And, all right, very good. I'll get over here on this side and.
Make sure you smile real big for
Yeah,
the camera.
yeah, that's.
Don't look so blue.
All right, thank you, sir. Absolutely.
Thank you both.
You gotta do elbow bumps now. So.
Rather than bounce back and forth. Then we have the presentation of the Triad Salt Awards.
Are you doing that, or am I doing that?
Lee's doing it.
I got the foot.
Yes, and I was looking to see if Ron was coming up or standing back there.
Before we bring everybody up here, one of the things that we've done in Orange County for the last year or so is try to recognize all the good things that are being done by the sheriff and the men in the sheriff's department. Right now, you're seeing all kinds of riots and examples of some things that police should not be doing. But I want to let you know that none of that happens in Orange County. We can be very proud of the people that we have. Usually most people get any kind of contact with law enforcement when somebody, when a deputy or a police officer asks for your license and registration. But we have a lot of times when these people are really doing far more than what they really are required to do and doing what they can to take care of the citizens of the county. So if I could get Deputy Justin Neal to come up, Deputy Eric Peterson, Chief Sheeler from the Barboursville Volunteer Fire Department, Pastor Anthony, and Mr. Joe Parrow. Last year, on the night before Christmas Eve, on December 23rd, and Deputy Neal and Deputy Peterson were made aware of a family with 3 children that had absolutely no Christmas gifts, had absolutely nothing for their family's Christmas. And so Deputy Neal and Peterson managed to work with Pastor Anthony and Mr. Aparo and the Barboursville Volunteer Fire Department, and managed to come up with $700 so that this family would have a nice Christmas. And that's something that, you know, is not in the deputy's description of duties, but it's the kind of thing that makes Orange County a really nice place to live when you have that many people and that many groups are willing to go out and help out the citizens of the county. So, so I've got an award from them, each one of them recognizing the contribution they made in the county, and also a letter from the Attorney General's office, who is also recognizing the kind of thing that the law enforcement officers and the people of Orange County do. So if I could start off with those. The letter from the Attorney General's office is pasted to the back, so I didn't lose it. Deputy Justin Neal. All right. Okay. Deputy Eric Peterson.
He's not here today.
He's still coming back from, okay. Will you make sure he gets this, Mark? Mr. Pearl. What a great job you're doing. Thank you. Elbow bump. All right. We caught the elbow bump. All right. Reverend Anthony, again, thank you for what you're doing, and I know you have to do this every day. That's part of your duties, but we really appreciate it, and thank you very much. An elbow bump here?
I was wondering if I got one.
Okay. All right. And for the Barboursville Volunteer Fire Department, again, you raised all that money in not too long of time. Thank you for all of what you do. An elbow bump. All right. Thank you all very much, I appreciate it. Want to get a group picture as a group? All right. All right, thank you very much.
And also tied in with this, I'd like to thank Sheriff Amos for what he's done with the Triad program and bringing Ron on board, Deputy Kesner. Noticed a whole lot more people out there, tremendous amount of activity, and hearing nothing but good things. So thank you, Sheriff. Thank you, Deputy Kesner.
Next, we have Sergeant Shannon Dixon. Sergeant Dixon encountered a citizen who was addicted to cocaine. And this citizen really wanted to try to get himself some help and get admitted to some sort of assistance and some kind of assistance program. And there just wasn't any available. So, you know, he worked at it. He worked at it and kept at it and kept at it for several months until he finally got this gentleman sent into a treatment program. Now that's the kind of dedication that you just don't see across much of the rest of the country, but you certainly see it in Orange County, and you see it in the sheriff's office and his deputies. So, Sergeant Dixon, thank you very much for what you've done.
Thank you, sir.
And this is the kind of thing that makes the community proud of the sheriff's office. Thank you very much.
Teaching old dogs new tricks.
That's right. All right. Next we have Jim McGrath from the Rappahannock Rapidan Community Services. Mr. McGrath.
I hope it's okay if I take this off to talk, otherwise it's tough. So I appreciate being here this evening. It's my annual presentation to the Board of Supervisors on the Community Service Board and Area Agency on Aging and what has happened over the last year. And I would just like to start with, fiscal year 20, which just ended for us, wasn't all about COVID. A lot of really good things were happening within our organization over the past year. And I think of real importance was at the beginning of the year, the board of the organization getting together to focus us on what the priorities of our organization were during the year. The first priority was decreasing difficulty of access to our services. In the 2 years that I've been with the organization, this is something I hear repeatedly. It's just too hard to get into our services. And so that was identified by the board. Additionally, the need for increased outreach and education on the available services. We often hear too, wouldn't it be nice if the Community Service Board did this, only for me to answer, well, that is something we do. I think we have 72 different programs that we actually do run in the organization. And so making sure the community is aware of those things. And I've been told by Lee to give a pitch for that when I'm done today, so I have that as a reminder. To continue to implement industry best practices and evidence-based practices, which we are doing, to be able to better demonstrate how effective our services are, and our ability to increase our responsiveness to changing community. And really, we're seeing lots of this is happening, especially in some of the CSA, the Children's Services Act, the need for new programs, new services, and our ability as an organization to be much more adaptable to that. Other things that happened, we were able to purchase and then lease to Oxford House, the region's first sober living home. One of the observations that we have is we have a residential treatment program for individuals with substance use disorder. When they are discharged, there is nothing in a 5-county region for those individuals to go. And through private donations, we were actually able to purchase a home, which then we have leased to Oxford and now have a sober living home in Culpeper that can, for 8 gentlemen that can serve our region. We have a new behavioral health clinic that's been completed that will open up, which will serve our northern region. We've been able to obtain private funding for a regional opioid response director position. And this is really a critical position for us. As we know, our 5-county region is a very high opioid use area. There are lots of groups like EPIC, some of the other groups, but the response and how those individual groups are responding to this crisis are always disjointed. And being able to bring this person on board really to help organize all of the community coalitions and groups that are working on this problem, as well as the provider organizations. Additionally, that person has filed for our region to receive funding to be identified as a federal drug-free community. Hopefully we will hear about that grant in the next couple months, but that brings $125,000 annually into our area for increased prevention activities. And we will be looking at, it's a Communities That Care program that we'll be looking to implement through that. We've been able to adjust a lot of our salaries during this year. What we did find that one of the problems that we had was we were no longer market competitive with salaries and could not hire. That has been addressed this year. We partnered with George Mason University to really begin looking at what demographic factors were affecting the effectiveness of our outpatient services. And we had a master's project team that worked on looking at those correlations for us. We started providing medication-assisted treatment inside the Fauquier Adult Detention Center. So while prisoners are in the jail, they are receiving treatment by our clinicians as well as medication, because we know when people are released from jail, the incidence of overdose death is, I think, about 250% higher during those first 2 weeks of release. So we can get those individuals on medication and into treatment without losing them between jail and our front door. We've renovated our office. We've initiated and expanded peer services because we do know that that is one of the most effective entries into our service delivery system. something that means nothing to everybody, but was actually a very big deal for us, is we achieved organizational compliance with the Home and Community-Based Service Waiver Community Rule. Just, it was a lot of work and very important for us in our work that we do for adults with intellectual and developmental disabilities. And it's not something that we talk a lot about, but that is actually the largest budget per dollar department within our organization. And in order to be able to continue to do that, organizational compliance was required. We've expanded our permanent supported housing program, and this is particular housing vouchers along with case management for being able to place and keep placed in homes people who have experienced chronic homelessness throughout their life. And we increased that to 48, so we doubled the size of that program at the beginning of the year. We've worked with drug courts here in here in Orange. We're working with the Commonwealth Attorney's Office on development of drug court policies and procedures, and we have members of our staff working on that. We've expanded our LINK program into Orange County as well as some of the other counties, which is an intensive case management program to keep kids out of foster care, because we know if we keep kids out of foster care, their outcomes at later points in life are so much better. Plus, it is so much more cost effective to have us providing case management on the front end than you to be paying for foster care for kids on the back end. We've brought in alternative transportation for individuals who have been assessed by our staff as needing involuntary hospitalization in a state hospital. Previous to alternative transportation, they always fell on your sheriff's office to do those transports. And now about half of those transports are being taken from them and being done by alternative transportation program. And we were able to implement a new rental voucher program for housing for individuals with intellectual and developmental disabilities. So that was at the beginning of the year, but then of course it really has always been just about COVID. So when COVID hit in March, we closed all of our congregate sites and implemented remote staff workforce practices and reassigned all of our program staff to community outreach and support of people in the community. We converted all of our outpatient treatment services to telehealth services. One of the benefits that we did see from that was our no-show rate decreased dramatically. The real challenge for us was those individuals who needed treatment during this time period but did not have access to technology. So I feel it's my obligation to push the broadband agenda, which I know you guys get hit on all the time. And people have actually reported very high levels of satisfaction with the telehealth services. We also, when we closed our senior centers, converted all of those services to home-delivered meals. And prior to the reopening of our senior centers, we were delivering 1,300 meals per week in our 5-county region. We were also able to take advantage of all the available financial relief efforts. And because of that, the Payroll Protection Act, CARES Act money, all those types of things, we had no staff layoffs or furloughs. We have been able to maintain agency financial stability through this crisis and really protected our 375 staff. No one received any reduction in hours or reduction in pay during this point in time. And we were able to ensure that all staff and clients were protected with personal protective equipment. As you know, we have residential programs, we have high-risk individuals, and keeping those individuals and those staff safe is critical. We have had no internal transmissions of COVID during our time. So with that kind of as a backdrop, we did need to try to put together our budget, which became very challenging just with the pandemic, the uncertainty over potential mid-year budget reductions by the state legislature, and having staff remote teams, as well as being able to address the priorities that our board set for our budget this year. And those priorities were staff salary increase budgeted for 4% increase for staff, level staff contributions to our employee healthcare plans. It has been one of the real issues we've had in our recruitment of staff is our healthcare is not competitive. So for the second year in a row, having no increase for our employees. We wanted to be very conservative for any funding shortfalls or decreases based on our inability to budget. We still need to work on our capital budget plan. We have properties that have been neglected for far too long that we really need to take care of. And you can read through, I don't need to go through all the other stuff. But. So our budget highlights. Our revenues this year, we did pass a budget with the board. Our budget is $27.63 million. That's about a 1.5% increase this year than last year. What I, want to thank all the members of the boards of supervisors, and I'm going to Madison after this one today, and they will get the exact same speech and the exact same thank you. Our local boards of supervisors stepped up incredibly for us this year. And so we saw about $435,000 additional local funds this year in what I know is a very difficult budget year. We did see an increase in state funding of about $600,000. The challenge always for us with our state funding is it is so earmarked. We have no flexibility to cover any type of increases otherwise. So if you see $600,000, that's $600,000 in new programs. To be very conservative, we did decrease this year's fees by almost $1 million, about 9.7% over last year. And our federal funds did increase, and we were able to do that because the federal government, with their aging monies, allowed us to carry money over from one fiscal year to the next, which is not typical, but was critical for us to be able to balance this year's budget. Our expenses, again, increase in personnel expenses of about $388,000, which did include a 4% salary adjustment for staff. We added 9 full-time positions to our workforce, and we also did some reclassification of some leadership positions in order to better respond to community need. And again, we were able to keep our healthcare insurance flat. Just a quick visual of where we get our money from. About 33% of our funding comes from fees, predominantly Medicaid fees. State was about 26% of our budget, about 10% of local sources, and 11% of federal funds, and various other sources, grants, all that type of stuff on the other sources. Where does our money go? Like most human service organizations, it goes to our staff. 62% of our payroll, and you can look through all those if you have any questions I'm happy to answer. So projected service outcomes, you will see here by category the amount of individuals we expect to serve by each category, as we are required to report to the Department of Behavioral Health and required to report to you. So I always apologize, this is a terrible graph, but it's the way they mandate we report it. The first chart is for behavioral health services, or mental health services. So you will see we will support about 2,000 people this year, and about 51 of those are from Orange County. The next chart is developmental disability services, and you see organizationally about 688 and 167 from Orange County. And a lot of those will be case management that we will provide services for. Substance use disorders, again, we will support 536 people with a substance use disorder. This is predominantly case management and treatment for a substance use disorder, and 100 of those would be from Orange County. And just, you'll see how the breakdown, like the one up from the bottom is intensive residential services, that's Boxwood. Okay, and 29 people from Orange are expected to go to Boxwood this year.
Question on the one above that,
Yep.
served 1, but 16 are from Orange?
No, that's not right. It's high, I believe the number was 61, so I must have, when I was cutting and pasting your numbers, I must have gone over one too many, so I apologize. I'll make sure you get that corrected for you.
Okay.
Paying too much attention, too close attention.
Well, that was an easy one.
That was an easy one, too. I don't know, I'm sorry I missed that one. I did throw the next slide in, not that we have to report these numbers to the state, but these are the prevention activities. And you can see that our prevention workers gave presentations or trainings, we do naloxone training or mental health first aid to almost 4,500 people in our counties. And unfortunately, I don't have that broken down by individual counties. It's just not information we get. But you see the number of views on our media campaign on suicide prevention and all that type of stuff as well. And taking back almost 47,000 medications. Emergency services, these are our crisis services. and we will do about 2,700 emergency crisis level services in the 5 counties and about 500 in Orange. And our senior centers, our agency plans. And so we have about 68 people who come to our Orange Senior Center on a regular basis. We have, I think, about almost 100 people who receive home delivered meals in our region as well. So that's my annual spiel. If there's any questions, much more interesting questions you might have about what we're doing as an organization. And like I said, I have a couple notes of follow-up for Lee, because he hit me up last week on those.
I had a question on your fees. You said you decreased it by almost $1 million.
Correct,
And I think I heard you say that was mostly Medicaid.
correct.
Can you connect those dots for me a
Sure,
little bit? I mean,
yes. So, we run, several programs. The biggest one we run is we run an adult day program for adults with intellectual disabilities.
Right.
That has been closed. So we obviously cannot bill Medicaid for that closed program. We have almost 100 people a day who go to that location. So we have anticipated in our budget a gradual, we have reopened, but to about 20% capacity right now. So we expect to be at full capacity at that program, well, we budgeted for January 1st. So we just ramped that from 20 throughout the course of the next 4 months up to 100%. Same with our Visions program, which is our mental health psychosocial day program. Our billing at our clinics is slightly reduced for those individuals who have not been able to take advantage of telehealth, although we are now back open to face-to-face. We opened last week for face-to-face to return. So those are why we reduced those budgets.
so it's not really a reduction in the rate, it's
No,
the fact that
no.
the level of service changed.
Correct,
Okay.
yes. Yep. Other questions?
Had Lee's notes?
Sure. Lee has suggested if the county has any extra care funds laying around, one of the things that we have been able to work with is one of the other counties to run ads. People are really struggling. We know our crisis call volume has escalated. What did someone say the other day? Alcohol sales in the state are up 300%, and the bars and restaurants are almost closed. Those people are coming to my door. But again, people who have historically not been involved with our services don't necessarily know who we are or how to get a hold of us. And so we've been running ads in one of the northern counties' papers that was being supported through CARES funds. Just to say, you're struggling, call this number, we are here to help, these are the services that you could get. And we're gonna run a series of those. So bring it up if it's ever comes across your agenda that you're looking for some place to spend some of that extra CARES funds, that second round of funds that you all have gotten, we will do so. There is not a Hidden in Plain Sight that is virtual. Hidden in Plain Sight is a program for parents that a couple of other law enforcement jurisdictions run that teach parents how to look in their kids' rooms and go through and recognize signs of abuse and use. Culpeper PD does it, Fauquier County Sheriff's Office. And there was a question about, could we bring it down here, do it virtually? They do not offer that virtually for people.
We've actually had it done at our schools. It's pretty interesting is that how creative those teenagers are.
Yep. Yeah, and it's a really good program. I feel obligated to remind the board, I appreciate the appointment of a board member last week, I believe it was. And actually she came to her first board meeting this afternoon, and we are still short one board member for Orange County. And as always, we always encourage thinking of somebody. We have a mandate from the state to encourage people who have used our services to be on our board. So if that's an opportunity, offer that up. It's a hard
list of
one.
ex-alcoholics?
We do. We have people who have had substance use disorders who are serving on our board, who have served with us. But it's a mandate from the state, and we don't necessarily always meet that, or we might, but people don't disclose. So that is fine. There's not really anything they do against us other than say, please ask your boards of supervisors to appoint somebody, which I have now done. I also think it's important to mention to the board the governor's executive order 70 that came out last week. because it will have a very adverse effect on law enforcement. If you're not familiar with Executive Order 70, it really relates to the state hospital's acceptance of individuals under the temporary detention order, that is the involuntary placement. The state hospitals are over capacity. The governor's office has put out that that is related to COVID. I would argue is a much bigger issue than COVID. They were over capacity prior to COVID. But what this order does is two things. One is if someone comes to us from law enforcement or anywhere else that has not been through an ECO order, okay, the state hospitals will not accept them. So they will sit in ERs, and we've had people sitting for days in hospitals. The other part of it is, if they are under an ECO, to expect delayed admissions. And a few weeks ago, we had two of your deputies, I think for 2 days at Culpeper Hospital, staying with somebody because we could not get a bed. We will continue to do everything possible to continue to assess, but it's clogging up our ERs and it's clogging up our law enforcement, and it's costing a fortune inappropriately. So I was feel obligated to bring that one up. If there's any other questions, I'm happy to answer them.
Thank you very much, Mr.
Thank you,
LeGrand.
Dan.
Thank you, I appreciate it, everybody, take care.
Have a good evening. All right.
Yeah, the thought of a deputy spending 2 days in an emergency room.
Ridiculous. All right, item 4, this is the consent agenda.
Motion to approve.
Second,
Second.
all in favor?
Aye.
Passes unanimously. All right, new business, award of the contract for recruitment services, Ms. Amos.
I'll be up here quite a few times this evening. Take this off. All right. Back in May of this year, Orange County released a solicitation looking for recruitment services. This was advertised on our website, the Orange County Review, and EVA. We received a total of 36 responses. After concluding the review and interview processes, the selection committee recommends entering into a contract with SGR. SGR provided a concise, clear, and detailed proposal that best fit the scope of work that we were looking for. They have experience recruiting in the public sector, which will help the county find the best fit for director-level positions. The county will utilize the contract to recruit for a director of human resources and planning and development services. It is the recommendation of the selection committee that the Board of Supervisors authorize staff to enter into a contract with SGR for a period of 1 year with the option of 4 additional 1-year terms. The contract is, of course, subject to annual appropriation of funds by the Board of Supervisors.
Any questions for Amanda?
Yeah, when you say this is a 1-year contract, is it an annual payment, or is it payment on a specific recruitment?
It's on the recruitment.
Okay, so they're just be on tap for recruitments that we have.
Yes.
Okay.
Like as needed basis. And 36 responses was a lot, but we got through them pretty quickly.
All right, any other further questions or comments on this?
I would move to approve.
A second?
I'll second.
Okay. All in favor?
Aye.
Passes unanimously. Thank you very much, Ms. Amos.
Thank you.
All right.
Don't go anywhere.
Next one is approval of the contract to purchase dispatch console furniture.
Okay. Console furniture will be needed to be purchased for the dispatch center for the new public safety building. Chris found a cooperative contract with HGAC for, I'm hoping I'm saying this right, Zybex Systems, which will provide furniture and installation. Furniture pricing and installation was quoted at $93,560. Funding has been budgeted in the capital improvement plan under furniture and fixtures, project number C1149.
Amanda, does this go back to when Nikki was here and there was a major discrepancy on the console costs, do you know?
I'm not aware. I don't see Chris up
Okay,
there, but I'm not
Okay.
sure, but I can find out for you.
okay, because I think that might be where a lot of that
This is the firm
discrepancy.
that Nikki originally was talking.
Okay, so that's where, at one point, she gave us one number, and then at another point, we were discussing the consoles and came up with a totally different number that
But I
was.
think it had to do with the number of consoles.
Okay, all right, very good. Any other questions or comments?
Move to approve.
Second.
All right, all in favor?
Aye.
Aye. Opposed? Passes unanimously.
Thank you.
All right, thank you, Amanda. Then the next one is 5C, the draft infectious disease preparedness and response plan. Mr. Voorhees.
Thank you, Mr. Chairman, board members. In response to the COVID-19 pandemic, the governor asked the Department of Labor and Industry to promulgate standards for the workplace. As y'all are aware, we have a lot of different safety standards that apply, like wearing steel-toed shoes and those sorts of things. And then we have training that goes along with that. So with this being a unique situation, the Department of Labor and Industry developed some rapid interim standards and promulgated those very quickly. And they've given us a pretty short deadline to come into compliance. Essentially, this requires us to classify all employees into risk categories, low, medium, high, and very high. And most of our employees are going to be in the low and medium categories, but we do have public safety personnel typically are in the high and very high category is really reserved to like physicians and nurses in a hospital setting with actual sick patients. So we've gone through a draft process to categorize our employees, and then we need to distribute training on infectious disease, risk reduction and prevention. We have developed, staff has developed a way to roll that out in a video through our Know Before training. I don't know if any of you all get those phishing alerts that sometimes you.
There's got to be a better way of disseminating that information, because I will tell you, at the board level, we tend to get
A wide variety of stuff.
exterior emails that, some of this stuff just looks like everything else we get.
Right.
It doesn't have any of the telltale.
Right. Well, the good news about that system, though, is it is a way to distribute, there's a way to distribute informational modules to our staff. And so we've put together a very short and sweet training. I think it's only about 9 minutes that covers all the legal requirements. And we've worked with VACORP on some of this pro forma work. We've got checkoff forms, and that's the plan here, is to adopt this set of standards that has us categorize, train, and inform, and then we'll be in compliance with the DOLI standards. One other thing it does have in there is how do you handle folks who are suspected to have the disease, and then a return to work procedure. And so with that, I'm happy to answer any questions.
Is this the HR via SharePoint mandatory seminar? Like I said, there's got to be a better way to disseminate this. This is one that I got today. Anybody have any idea? No. Okay, very good.
If I did it, I already deleted it. I got
Well,
it.
and that's what I was going to do. I saved it.
We haven't
specifically.
rolled anything out yet, so,
Okay, well, and that was my point, is we get all this interesting stuff that, yeah, okay.
I have one comment. You have the EMTs rated as high. It would seem that those medics that have to do intubation should be rated as very high, since that seems to be one of the criteria for very high.
thank you for that comment, and certainly all this has been distributed to department heads for feedback, and we can move people between categories if they find that we've misclassified them. Our initial reaction was just folks in a kind of an ER or hospital setting was the very high. We don't know when we intubate whether that person's actually infected or not, and PPE is required, but we'll sort that out, and that'll be something that we'll look to the
I mean,
department
that's
chief.
the one where you hear the news and stuff like that, the people that are at most high risk is when they're trying to get down in and intubate somebody. We'll just, I mentioned it to Mort, and I think I raised a question in his mind.
Very good.
I have a question. This is billed as an emergency temporary standard. Do you have any definition or have been given any guidance as to what temporary means? I mean, are there conditions specified at which this gets rolled back, or is this, rather than an emergency temporary standard, is this going to be the forever ongoing standard? I mean, it seems to me that there's a financial issue here potentially of, not insignificant consequences, and it affects our planning going forward if this is something we're gonna be living with forever. And I'm concerned frankly, because it says it's designed to prevent the spread. Oh, is this a vaccine? I wasn't aware that this was a vaccine. So under that kind of a criteria, this could go on forever, because the so-called experts say that COVID-19, by whatever name you're gonna give it, it's gonna be with us, for the rest of humanity. So, I mean, I'm being a little bit picky here, but I just think we need to keep our eyes wide open in doing, I'm not opposed to, doing, obviously, it's a sensible approach. I'm not worried about us. I'm worried about the things that come down with VAC in front of it.
Yes, sir.
I mean, a lot of these same kind of things that they should do, or ought to be doing if you've got the flu or any of the other infectious diseases. This is just, this one happens to be a little more severe consequences.
And I think in response to the sort of tenure of this, is that, as I understand it, because they used an emergency temporary standard, the time frame is January 15th, 2021. If they want to extend, they'll have to go through another administrative procedure, and possibly go to the General Assembly if they want to go beyond whatever their emergency limits are. We're hopeful that they'll roll this back at the point that the pandemic's over, but, there's some rule about the most permanent thing is a temporary government program, so, will remain to be seen. But this is what we've been directed to do by Department of Labor, and try to do it to the best of our ability.
I would move to adopt the preparedness and response plan and the rest of that recommended action.
Is there a second?
Second.
All in favor?
Well, a couple comments to make. This is, an example of how government does things in a way that only government and possibly huge corporations does things, which is, it's 65 pages. This is for Orange County, 65 pages document, which no one's ever going to read. Imagine if we, if in each of our households, where there's 2 or 3 kids running around, if we adopted a protocol for all the things the kids weren't allowed to do. We're gonna put this in a document. I mean, it's so much of the stuff is common sense, and if this were 5 pages, I could have some respect for it. The fact that it's 65 pages, to me, it's just governmental mumbo jumbo. And I realize this is not aimed at our staff. They're doing what they have to do in response to the state mandate. But
I guess I was assuming the second half of that was not a part of our document, although 30 pages is still pretty extensive.
Well, it's
As Mr. Johnson said.
kinda like here's the board packet.
Yeah, that's
Right.
well, I didn't think I was ever gonna finish reading the definitions. There were 5 or 6 pages of definitions.
Well, yeah, exactly. I mean, yeah,
I certainly want to.
there's more definitions there is in our zoning ordinance.
This might be longer than our zoning ordinance.
The definition of a definition is.
Would want to support that general philosophy that, my comment back to staff when we got this, when everyone's eyes glazed over, saying, how much of this, bureaucracy we're going to have to do, was can we make it as simple as possible? And with no disparagement intended to be sent to VACORP, who was trying to help us. They created a kind of boilerplate training that was 45 minutes long, that they said covered everything that had to be covered. And my response was, no one can stay awake that long, on this topic. We've all been living this topic for so long. We know the common sense piece. And staff was able, I think Stephanie in particular focused on the minimum amount of stuff that we needed to push into this know-before training to get it down to 9 minutes instead of 45. So sympathetic. We think that this document covers us legally, and we tried to pare some things down, but it's still a lot.
I think it's organized better than the state document.
Oh, absolutely.
Thank you.
Any further comment? Going once?
Any further comment will be with my inside voice, not my outside voice.
Very good. In that case, all in favor?
Aye.
Aye.
Thank you, board members. I want to thank Glenda for all her work on this.
All right, very good. Item 5D that we added, Amanda, you wanna come up and talk to this? The sheriff, had a situation come up that needed to add this at a later time than normal to our agenda.
Yes, we received a request from the sheriff's office to formally surplus and donate a sheriff's office canine known as Kazan due to unforeseen circumstances, including the inability for it to perform critical duties. It is in the best interest of the animal and the department to surplus and donate it as soon as possible, to present the department from further encumbering kennel, feed, and other charges related to its care. Chief Deputy Lacasse has requested the animal be surplused and donated to a canine sports team, as no other law enforcement agency is willing to take on the animal. Tom has prepared an adoption donation agreement. It was said that the animal, I think Stephanie may have briefed you on this, it was becoming apprehensive and unwilling to do drug seeks inside of vehicles. They tried training to all extent, and he just regressed, so they feel that it's the best efforts to just donate him to another organization that could utilize the skills that he has.
Are all employees going to go through this scrutiny? I'm sorry.
Just board members.
Okay.
So he will be taken care of, he just won't work out for the sheriff's office.
I
What's a
assume,
canine sport team?
yeah, I was gonna say, yeah, is that something that exists, or is that a generic term? I'm not sure what that is.
It's a couple, that they take in canines with issues,
So it's an existing organization of
yes,
some,
it
okay.
is. And I have their contact information and a website, if you'd like to see it, I can email it to
So they've got a website.
Yeah, I believe that Mr. LaGraff has a line item there.
My one and only concern is that the recipient has been somewhat, checked out and.
Yes, Mike
Okay.
knows them.
Okay.
All right.
So moved.
Okay,
Second?
all right, any further discussion?
Yeah, I am concerned, if we're gonna start getting rid of, people because of their inability to perform critical duties, this board maybe needs to watch out,
That's exactly right.
We might be next.
I think we are next.
This is a very narrow motion. Let the record show.
Well, I don't have any memos on you guys, so I think we're good.
Every 4 years this comes up for us.
That's right.
Yeah, good point.
All right, any further discussion? All in favor?
Aye.
Opposed? Passes unanimously. Thank you, ma'am.
Great, thank you so much.
All right, I see no old business. Any department director constitutional officer reports? Case, Mr. Latchney.
No report, Mr. Chairman.
Mr. Voorhees.
No report, sir.
All right, on to the non-performers comment period. Any board members have any comments?
I actually do. I'd been saving this one for live instead of over Zoom because trying to communicate over Zoom is ridiculous. We have multiple sites for distribution of our recyclables. There's only the one in the town of Orange that is not manned, which I now see we have a sign out warning that leaving all the crap out that people leave out, rugs and furniture and the other crap that I keep finding out there on property that is not owned by the county, but is owned by Union Corrugating Company, that I wrestled with to allow the county to be able to use that property. The fine, I believe, is $1,000, and I'd like, if we could, to consider at some point in time upping that fee so that if we find somebody there, we can make there be an understanding that it's not appreciated, it won't be tolerated, and if we get enough people, we'll have enough money to actually have a place where we can have a attendant there to watch it. I'm just absolutely disgusted when I ride by half the time.
And I assume we're bearing the cleanup cost.
Oh, yes.
Under some,
Oh, yes.
under some budget category. Are we at the point where it's severe enough that having an attendant there would actually cost us less than the cleanup? I don't know what the numbers look like, but it seems to me it wouldn't take, you wouldn't have to go very far to have that be balanced.
I don't think it would help, because unless we attend it 24 hours a day, it's not enclosed.
Yeah, that's right. Oh, I know the site you're talking about, it's not
Yeah.
enclosed, that's right.
And it is become a pretty serious problem. Aaron and I were just talking about it today, and Aaron's desire would be to get rid of it as it is right now, because it's so bad. But we've talked about, we may need to find some money to somehow put cameras up, some kind of way to identify these people, but they are dropping, like Teal said, mattresses, furniture, trash.
Do we have an option of enclosing it and manning it? Is that? Is
I
that-
guess if the property owner allows it,
I mean,
it's not our problem.
Well, yeah, not at that site because it is part of our right-of-way, or my former company's right-of-way.
Right.
So no, I don't think they're giving up right-of-way for that. And the only place you could do anything with it at the present location is to move a little further down the line onto Dave Rutt's property. And then we'd have to purchase the property from Dave, we'd have to fence it in, all the other things that go along with it. So,
How much actual recycling is going on there? Is it a heavily used site for its intended purpose, not for mattresses, but for its intended
Well,
purpose?
it was at one point,
Yeah.
but it's gotten so contaminated now, it's hard to determine. I don't know the day-to-day numbers. I'd have to get with Aaron on that, but
Kurt, we've got a, recycling at the landfill now
yes, sir.
with the compactor and everything.
And we have new one, I was just informed today that if you guys recall, Gordonsville had requested that we put recycling on property that they owned. This was prior to Ted being here, and as I understand it, they're soon going to be ready for that.
Okay.
So maybe the
I
idea.
wonder if we should maybe talk to the town of Orange, if they have a piece of property, old town shop property, that maybe they would be willing for us to use for that, so there'd be a,
Yeah, they've actually acquired a number of parcels here in the past year.
it really needs to be a place that, can be closed in, even if not manned, at least closed in, so people aren't coming by there at 11 o'clock at night dumping off stuff.
Yeah, I mean, I don't think we should just tolerate the way it's being used.
No, and my intent here, board comment, was the warning shot over the bow, before I asked that we, number one, like I said, either raise that fine to $10,000 an occurrence. And I think an occurrence is a rug, a piece of furniture. If it's broken and it's in two pieces, that's two occurrences. And if not, yeah, then to move it, because as it is with the drivers and all the employees moving around through there, there's basically somebody moving on the lot behind it from 2 a.m. in the morning until 7 or 8 o'clock at night. So, and a lot of these things, I've actually seen when I would leave and go out in the morning to go get something and come back between 8 and 9 o'clock. And it was like, how did you sneak in here and do that?
Could we go ahead and get with the town of Orange and start exploring that option?
Alternative.
And next meeting after, come back with what the town has said, and then decide what we're going to do there.
Yes, sir.
Unfortunately.
I mean, you know, another thing is to look at what it will cost to put up a camera system or something like that. But I just know that it's hard to, unless you got, you know, some grainy, it's not film, it's digital, but, you know, that's not gonna cut it. It's gonna have to be something, gotta be good lighting, and there's gonna have to be really good,
High quality.
digital image there. or else
Something
you're
to
not
hold
gonna
up
be
in court.
You're not gonna be able to get anybody convicted.
Yep.
Yes, sir.
Any other board comment?
I'm just, glad that we're all together again.
Yes.
Yes, no more Zoom.
Pass it on.
Yeah, that's right. Can you, we have to learn Morse code or something?
We need an intercom system in here now.
It is in the echo chambers, so,
The cone of silence,
yes, very good.
which is sad that we all know what that is.
All right, informational items, and then appointments to boards, commissions, and committees.
Yes.
Okay, go ahead, Mr. Goodwin.
I would like to appoint Arthur Bryant as the Town of Orange rep for the EDA.
Okay, and I would like to appoint Julie Zalemaker to the EDA, and at this point in time, she will continue serving on the Planning Commission. And she has expressed great desire to me, because she has learned so much and is continuing to learn, that she could carry that knowledge over to the EDA, and at some point in the future, that's what would probably happen, is she'd go over just to the EDA. Okay.
I would note that, not making a point, but there should be another opening here for the Community Services Board. We've only got 2 of the 3 slots filled.
Okay.
We need to, everybody just be aware that we're looking for somebody.
All right. What?
Yeah, Mr. Chairman, I'd like to appoint Mr. Jeffrey Palmer as the citizen representative to the Lake Anna Advisory Committee.
Whoa.
I made sure we were all seated before I made that appointment.
Yes, very good.
That's been a very difficult slot to fill.
Virtually
You
impossible. Yeah.
Well, you know,
Did, Mr. Palmer understand it is a lifetime appointment?
beginning with his first meeting tomorrow night if we do this. Well, it is, as you know, while we have a few homes in and around the lake, most of them are not residents of Orange County. They're weekend places and things like that. Mr. Palmer lives there. If you know where Fraser's Landing, anybody knows the area down there, lives right on the water. He's a retired Navy guy, been there about 3 years now, and is an avid fisherman and waterman and just having a ball and loving it and wants to be involved. And so I'm excited, frankly.
Can't do better than that.
Can't do better than that.
All right, so before he runs away from that, do I have a motion to accept these appointments?
So move.
Second.
All in favor?
Aye.
Aye.
Very good. He's stuck for life now. Nothing on the calendar that I know of. I don't think we have any additions or changes to it.
Excuse me.
Yep.
Susan, if you don't mind, would you send Mr. Palmer an email? Because we do have a 7 o'clock meeting tomorrow night, and I'd like very much for him to, he's aware of it. I just want to confirm that
He knows he's now obligated, huh?
I'd send him one, but it's better that it be official from you, if you don't mind. Thank you.
It's confirmed. We'll see you tonight.
Yeah, that's right.
Good. All right, then at this point, we will head towards our closed meeting. Mr. Latchman.
All right, whereas the Board of Supervisors of Orange County desires to discuss in closed meeting the following: consultation with legal counsel pertaining to actual or probable litigation, where such consultation or open meeting would adversely affect the negotiating or litigating posture of public body with respect to S power. Consultation with legal counsel employed or retained by the public body regarding specific legal matters, requiring the provision of legal advice by such counsel concerning security, conflicts, and public comment. Whereas pursuant to section 2.2, 3711A7 and A8 of the Code of Virginia, such discussions may occur in closed meeting. Now therefore be resolved that the Board of Supervisors of Orange County is hereby authorized discussion of four stated matters in closed meeting. Need that as a motion.
So moved.
Second.
All in favor?
Aye.
We are now in closed. All right,
It was just interesting.
all right. Susan, are you doing the reading?
Yes, sir. Members of the board, to the best of your knowledge, were the only matters discussed in the closed meeting public business matters lawfully exempted from open meeting requirements, and that only such public business matters as were identified in the motion by which the closed meeting was convened were heard, discussed, or considered in the closed meeting. Mr. Goodwin?
Aye.
Mr. White?
Aye.
Mr. Johnson?
Aye.
Mr. Frame?
Aye.
And Mr. Crozier?
Aye, and before we entertain a motion, there was one thing I meant to bring up before, and Mr. Voorhees will do it, regarding the historic courthouse.
Thank you, Mr. Chairman. Board members, I sent out an email briefly outlining a need that the court system has for dealing with COVID and trying to get back to jury trials. Today, Mr. Hildebrand and I, along with Mr. Kane, took a little tour over there. Teresa, the clerk, showed us what they had in mind. And I also met with our new Chief Judge, Judge Franzine, this afternoon at 4 o'clock to just make sure we are all on the same page. And so the long story short is they can't space people out in the existing courtroom to comply with sort of the COVID stuff. So their thought is if they could put the jury and the judge and the witnesses in the historic courtroom and keep the public and the media and all that in the existing courtroom, they could have a video feed and that would handle it. I've made it very clear in the email to them that the decision would have to be by the board whether or not you will grant access to the historic courthouse, as that is now in your care, custody, and control. They understand this would be only for the duration of this pandemic and respectfully
Could be forever.
suggest, request this. And then we've moved from thinking that this would be some big cost of retrofitting and what have you. At this point, after the tour today, it looks like we just want to replace the blinds and patch a couple holes in the wall where there's been some water damage and that's about it, really, and just run the AC and a dehumidifier and call it a day. There is a technology expense, but that's the court's issue with the court tech people to run that system, because they have to record everything and store it on the state judicial system for review and all that. So that's their problem to solve. They would like us to help fund that through CARES Act, and we think we can, work that into the budget. But all this would come to you formally in September with an MOU allowing this use at your discretion, knowing it's yours to decide, and then the budget piece would be in the CARES Act spending plan. So that, I just wanted to up to you. I think everybody seems to feel like it would be a low-cost temporary thing, and the judge is real workable on this. And any questions, happy to answer, and Kurt's here too, he looked at it
On
all.
a different note, are we gonna be able to cover the boys and girls request?
That is in our budget.
Okay.
So you'll bring this back to us formally in September?
Yes, sir.
All right. Any other
Anybody have a
comments?
problem with it? I don't have a problem with it.
Just like to make sure that they bring it to us properly.
Okay.
is all. Okay, in that case, I would entertain.
So moved.
Okay, second.
Second.
All in favor?
Aye.
Aye, we are officially adjourned.
Bye. Aye and bye. That's right.
Thank you.
I'm gonna put-
Hey, Kurt,